Hello, I am Dr. Jagdish Hiremath. I am a cardiologist and currently the chair professor of the Preventive Cardiology Department of MUHS, Maharashtra University of Health Sciences. This department, as you know, is being executed by the Madhavbagh Institute of Preventive Cardiology, the MIPC. I have the opportunity to head this department and execute some of the lofty ideas that we have with us. We are dreamers and we should be dreaming of reducing the cardiovascular burden of the state. It's a huge task, and for this we have to do whatever we think of is good for the society. It has happened abroad. Social workers have managed to reduce the cardiovascular burden just by dietary awareness, exercise awareness, smoking awareness, and so on and so forth. The key for reducing the cardiovascular burden in the society is awareness, awareness, and awareness. Of course, we'll be approaching the public by radios, by televisions, by smartphones, and social media. But one of the key activities that we thought was very relevant was to train hundreds of preventive cardiologists. They should become the warriors, they should become the preventive cardiologists who will go out in the society and bring the awareness to bring the cardiovascular burden down. In order to train them, we are floating a program or a fellowship of 1 year. It's 100 hours of e-learning. So if you put in just 2 hours in 1 week at home, despite your busy practices, you can still manage to finish this course. This will give you a lot of skills. The skills about anatomy, physiology, awareness about cardiac medication, cardiac procedures, investigations, very complicated procedures, and their post-operative management. Of course, the more skillful part would be to train all patients and related to improve their lifestyle. So diet, exercise, stress management, smoking awareness, all this will be in your armory. Currently, the scenario is on one end of the spectrum are the cardiologists, the cardiac surgeons, and the neurologists treating almost the end stage disease. And on the other side, we have a large population at large which needs training in prevention. There is a huge gap between the two, and this gap can be bridged by the people who complete this preventive cardiology course. There are courses for emergency medicine, there are courses for other aspects of medicine, but preventive is something very new. We have thought of it in a great details, and this course by the MUHS, in fact, is designed, personally supervised by me. So I think you will benefit a lot by completing this course of 1 year. At the end of this course, you will be getting a certificate from the MUHS. This certified you as a preventive cardiologist. What will it benefit? Not only it will decorate your clinic, which is a good thing to have a certificate in your clinic from the MUHS, but it will help you immensely in improving your own practice. You could be called to deliver lectures in the corporates for preventive cardiology. You could be talking on webinars and other aspects to talk to the population at large. You could be a very impressive medical officer in industrial houses, because somebody who has the basic training as an MBBS, BAMS, BHMS or Unani with a fellowship of preventive cardiology, you will be really sought after by these industrial houses to manage their workers and workers at large. One more thing I could think of was you could be great associates to cardiologists, cardiac surgeons and neurologists in managing their own practice. You could be the bridge between them and the patients in talking to them about the relevant aspects of risk factor management. One more brainwave that we had about the preventive cardiologists was to have not just a family doctor, but a doctor who instructs on health and preventive aspects. Think of somebody calling you every Sunday and talk to their entire family related to these aspects. I feel it's a great course, and I encourage you and request you to join it, and join it in large numbers. It will benefit you personally, it will benefit you, people around you, your friends and social circles. It will definitely get you a very prestigious MUHS certificate. But please think big. Be a part of a social movement of reducing the cardiovascular burden of the society.